Hey everyone, this is a part 2 of Podiatry billing and coding. If you haven't seen the part 1 video, the link is in the description box. Please go and check it out. If you are new to this channel, please click the subscribe button below this video so you get notification every time whenever I post new content, helping you to stay updated and improve your skills in this field. Join our community and let's grow together. Debridement of ulcer is a common procedure performed by a podiatrist. Let's see how to code for debridement of ulcer. If you want to pick the right code for the debridement of ulcer, you have to focus on these two things in the documentation. First thing, layer, whether it is subcutaneous or muscle and or fascia or bone level. Second, square centimeter of debridement. There are 6 codes used for debridement of ulcer: 11042, 43 and 44. 11042 is for debridement of subcutaneous tissue, first 20 square centimeter or less. 11043 is for the debridement of muscle and or fascia level for the first 20 square centimeter or less. 11044 is for debridement of bone for the first 20 square centimeter or less. Codes 11045, 46, 47 is an add-on code. Code 11045 is for debridement of subcutaneous tissue for each additional 20 square centimeter or part thereof. 11046 is for debridement of muscle and or fascia for each additional 20 square centimeter or part thereof. Code 11047 is for debridement of bone for each additional 20 square centimeter or part thereof. What is part thereof? For add-on codes, even the square centimeter is less than 20 square centimeter, still you can report the add-on code. Note, these add-on codes cannot be built separately. This has to be built along with the primary code. Let's see an example so you can understand it clearly. A provider performs debridement of ulcer on muscle and fascia level for 45 square centimeter. In this scenario, we have to check two things: the level of the layer. Here it shows muscle and fascia. The second thing is square centimeter. It's 45 square centimeter. Let's code this chart. For the first 20 square centimeter, bill 11043 for 1 unit. For the next 20 square centimeter, bill 11046 for 1 unit. For the remaining 5 square centimeter, bill 11046 for 1 unit. Finally, it should look like this: 11043 1 unit for the first 20 square centimeter, 11046 2 units for the next 20 square centimeter and the remaining 5 square centimeter. How to calculate square centimeter? The simple formula for square centimeter is multiplying the length into width. For example, document shows 5 centimeter into 4 centimeter, which means 5 centimeter length and 4 centimeter width. When you multiply, you will get 20 square centimeter. Let's see how to code the diagnosis for the debridement of ulcer. These are all the codes that you can use as a primary diagnosis for debridement of ulcer. For secondary diagnosis, you have to use non-pressure chronic ulcer of leg. Note, you have to be more specific on the part of leg and the layer level. When it comes to modifier, if the procedure was performed on toes, you have to be specific on the toe modifier. If the procedure is not done in toes, then use LT or RT modifier. Hey, are you a podiatrist and you need help with billing and coding? You can contact me. I'm Arun Kumar, a certified professional coder and biller. I can help you to grow your business. Let's see how to code for Hallux valgus correction with bunionectomy. The first thing you have to do is you have to check, is it done with osteotomy or not? If it is done with osteotomy, the next thing you have to check is it done with metatarsal osteotomy? If it is metatarsal osteotomy, then you have to check, is it at the proximal or distal side. If it is proximal metatarsal osteotomy, then you have to code 28295. If it is distal metatarsal osteotomy, then you have to code 28296. If the osteotomy is at proximal phalanx, then you have to code 28298. If it is double osteotomy, then you have to code 28299. In case osteotomy was not done, then check whether it is resection of proximal phalanx base. Then you have to code 28292. Or if it is first metatarsal and medial cuneiform joint arthrodesis, then you have to code 28297. Let's see what are all the primary diagnoses that you can use for hallux valgus correction with bunionectomy. These are all the list of primary diagnoses that you can bill for correction of hallux valgus with bunionectomy. Let's see what are the modifiers that you can use for correction of hallux valgus with bunionectomy. You have to use TA for the left foot great toe, T5 for the right foot great toe. Let's see how to code for correction of hammer toe. When the provider performs correction of hammer toe, then you have to use code 28285. Other hammer toe or toes, other deformity of toe or toes, congenital deformities of feet. These are all the coverable primary diagnosis that you can use. Secondary diagnosis is not required for this code. When it comes to modifier, you have to be more specific on which toe the correction of hammer toe was done. You can use TA to T9 modifier for more specificity. I hope you like this video. Follow me for more medical billing and coding related videos. See you on the part 3 of Podiatry billing and coding.